Hi, this is Sakib Rahman with the OrthoClips podcast series. And today I'm with Dr. Ryan Schreiter, who's assistant professor of orthopedic surgery and sports medicine at Temple University. And he's the co-head team physician for Temple football and team physician with Temple athletics. And today we're going to be trying to answer the question, should there be team doctors? Thanks, Ryan, for coming on the show.
You're welcome. Happy to be here. Thanks for having me.
Excellent. So let's get into it. So why is this even a question? What are the issues that make this worthy of discussion? We all know there are team doctors, but why should I be asking that question?
That's a good question. Ever since, we had talked about it, I thought, and my first gut answer is, well, of course, like there should be team physicians. They're absolutely necessary. And I'm extremely biased because I am one. I think in the same aspect, you could ask players that say, do we need coaches? And they would say, well, no, they're not. They're not running the ball. They're not shooting the pass. They're not hitting the home run. And, do we need managers? Do we need all of this? But I think everyone, to not drive home sports analogies, but everybody's a part of the team and everybody has a role. It does get a little complicated and a little complex when you talk about the role and responsibilities of the team physician, especially when you're talking about from a high school to a college to a professional team. And that's where I think we're going to dig in today to discuss those aspects of the role of a team physician.
Yeah, I guess what I'm kind of getting at are like, what are the conflicts of interest for the doctor that make this somewhat of a unique situation? Because, somebody gets sick, somebody has a problem, they see their doctor, or if it's kid, their parents take them to go see a doctor. You have a trusted relationship with your doctor, and it's, the patient and the doctor, and doctor says, this is what I think's going on, and this is what I think needs to be done. But here you kind of have the doctor for the team. So there is some conflict of interest there, which is, I guess, why I think I'm asking the question. So maybe you can kind of clarify those conflicts a little bit more.
Sure. So, the doctor, the physician, or myself is there for a team. I think the one easy component or the kind of mainstay thought process that I have is, hey, I'm a physician first. I'm here to heal. I'm here to provide treatment. I'm here to provide sound medical care, not only for the athlete in the moment, but looking at the welfare of the athlete 10, 20, 30, 40 years from now. And I feel that's a lot of times the perspective that maybe a coach or maybe an athlete doesn't have. In the same way, an athlete's like, hey, I'm going to push myself. I want to get back. Coach is like, hey, I want this kid to get on the field as quickly and as safely as possible. And so it does push myself or a physician as a team physician to really practice at the cutting edge of medicine, obviously within the scope of evidence-based medicine. So there is a responsibility. I think the conflict of interest lies within kind of an obvious scenario in which Hollywood has really taken the ball and run with it. And is that, the team doctor shoots the guy up with cortisone with a, huge needle into the knee or into the shoulder. The team doc is covering up a wound and, saying, hey, get out there. This is a Super Bowl. Let's go. And, I personally have never seen that exist, thankfully, and that's certainly not the trend that a lot of my colleagues practice, both surgically and non-surgically. So does the physician is part of the team, but he is not of the team, or she is not of the team, in that their role as a physician is to provide sound medical care and guidance to the athletes. There's no wins and losses, based on this. Injuries are bound to happen, just like trauma is bound to happen, just like osteoarthritis is bound to happen. So there is a need for a team physician, but when the temptation of, hey, I could really make this guy happy and really make the team happy if I get this guy back, instead of, I take the cast off in, I don't know, 4 days instead of a week or two weeks, or, let's just let this, let's push him back out of his normal protocol for surgeries a little bit sooner than later. um, you just start practicing outside of the scope of evidence-based medicine, and that's where it gets a little tricky, because you are getting pressure from not only the player himself or herself, but also the coaching staff, the teammates of the injured player. And so, yeah, that's temptation, and that's where our oath as physicians, our passion, our ethics, and our moral character really needs to step in and not be tempted to veer from the guidelines that medicine has set up. But it does still happen, Dr. Rahman, unfortunately.
So I guess I think of an example in that, correct me if I'm wrong, I think in professional football, the concern with head injury, um, and there being potential conflict of interest on the part of team physicians prompted an agreement to be had where there would be independent physicians or a neurologist involved. Am I correct?
Yeah,
In order to sort of mitigate the perception of conflict of interest. I mean, I think that's the
yeah,
main reason that's in place. I mean, because you could
yeah.
just hire a team neurologist, but I thought the thought was, no, there's going to be an independent doctor,
Mhm.
doesn't work for the team, and it's mainly because of the perceived conflict of interest. Am I
Yeah,
correct?
no, 100%. And the NFL and I think professional sports is very interesting, because now it was explained to me that professional sports is one of the highest profile areas of workers' compensation that there is. You have athletes making millions of dollars doing their job, which happens to be playing football. The same thing that an 8-year-old is doing, or a high school senior is doing. And the perception of the athlete is very interesting. There's surveys that the NFL has done that showing that over half of the NFL players don't trust their medical staff, and that they're not satisfied with their medical staff. And I don't know how to take that data and how to look at it. Or people just upset because there's other reasons, but maybe there is some truth to that, Dr. Rahman. Maybe you hinted at it, that there isn't a trust component, and so the players union, and the NFL and the sports societies of America did step in and recommended this independent medical um, examination. There's also spotters that are mandated in the NFL. These are athletic trainers that are in the sideline, or usually in the stands, and watch the entire game for any head trauma or concern for any traumatic brain injury. These athletic trainers have access to the full game film, and they're able to replay it, and they're actually able to stop the game at any moment, and they have direct access to the referee to stop these head injuries. That's the extremely hot topic within the NFL, the NFL Players Union, as well as a lot of the alumni looking back at that. And there's a lot of data and research going back and forth, and what with the chronic traumatic encephalopathy, there's really no hard data right now, but they're still saying that there is traumas and concussions, and multiple concussions can have a long lasting effect, as well as a short term effect as well. And me as a physician, we're constantly, I'm constantly, being aware of these aspects. And I mean, there are two different kind of topics too. We're talking about the NFL. I mean, as a college team physician at the Division I football level, I mean, I do feel like I am independent of the football team. I technically am independent. Um,
Let
and
me ask you
yeah,
a question then.
sure.
Do you think a team physician is more needed at the high school level, or I'll go to the other extreme at the pro level? Like, where is
Yeah.
the, need for a real team physician more
Yeah.
important?
Oh, I mean, I think at every level, and
Okay,
but
fair enough.
but I but the but as a high school, I mean, they're mandated by the Pennsylvania Interscholastic Athletic Association. I mean, this talk will be biased to Pennsylvania as well, but there's a team physician that needs to be at every high school football game. These are high level collision sports. Just the rate of injury and the rate of trauma within these football games. So to have a physician, ideally with an orthopedic or sports medicine background on the sideline, would be very helpful, to not only provide the right diagnosis, but also kind of shift in the right treatment plan. So at the high school level, I think that's extremely important. At the college level, I think it's just as important as well. And you did mention one thing about a patient relationship. When we're seeing patients from our community, there is a sense of trust. If you can build that trust with the patient, it, the outcomes, a lot of times are a lot better. I feel that being a part of a team, showing up at practice, being at the games, talking to the athletes themselves, does build a trust with the players, because they are your patients. I had
I guess
someone
that
give
I
me,
imagine that takes more effort,
yeah,
than, a patient just comes to my office. Um, maybe they've made a decision that they're going to come and see me. They could have picked 50 people.
mhm.
So there's already kind of a little bit of a built-in trust, whereas you kind of have to work at it a little bit.
Yeah. No, there's a little selling point, and I feel it definitely makes you be a little more confident with your diagnosis, because I feel like the players will know if maybe you don't know what you're talking about, or if you were unsure. They it definitely challenges you as a physician, especially to make a diagnosis quickly and efficiently, and to stand by it, and then to be able to admit a mistake, or admit, that, hey, I thought it was a AC sprain, but here, it could be coming from your neck. Let's look at your neck. And if the athlete trusts you, that process goes a lot quickly. And I think having a good team around you of athletic trainers, a coaching staff that trusts you, and if the other teammates trust you, that's bottom line, where it goes really well. You figure with a college team, you have a turnover every 4 years. With a professional team, geez, you could have some guys on the team for 10, 15 years, whereas you could have a whole set of different players every, 6 months to a year. When in talking about a team physician at the professional level, I think it's a lot more difficult, to gain that trust quickly, because you figure they've gone through those levels. They already have their people, they have their agents, and who their agent trusts, and who their college coach trusts, and um, hopefully the team physicians at those high levels, kind of have a reputation already, so that similar to the example you gave with a patient coming to see you already, there's a built-in trust. Hopefully, within large organizations, there's already a trust within
Right.
that.
Yeah, and I guess in your position, I mean, you're also trying to be kind of that link between, the training staff
Yeah.
and coaching and everything. Now, are you so? Are there other ways that this is done to set up in other countries? Do you know? And
Yeah.
other? countries that have a lot of organized sports that you kind of have this same system of athletic trainers and team
Oh,
doctors? I mean, is that pretty universal, or are there other
yeah,
models?
it's very universal. Obviously, I'm extremely familiar with the American model, but other countries do have similar uh, setups from a team physician as well as an orthopedist standpoint, and especially with um, the the team physician. You kind of talked about a link. There's a really great article as part of the American Medical Society of Sports Medicine. It refers to a linchpin holding two cogs of a wheel together, and that's what the healthcare provider is, or the physician. And then the two cogs are athletic success as well as the athlete's health and safety. And that's I thought that was a really good, because you figure both are kind of moving independently with health and safety and success, and then you're meant to hold those two together. Um, yeah, I mean, off the top of my head, there's some great research out of like the British Journal of Sports Medicine, as well as a lot of really good literature out of Australia as well. Um, I'm not as familiar with their setup, but it's very similar kind of across the board.
Hmm.
Um, but yeah, the yeah,
Yeah, I guess, we'll probably wrap up for the sake of time, but I did want to ask
sure,
one last question. So, how do you resolve conflicts of interest? I guess as
huh,
a specialty or as
yeah,
a group of physicians, I'm just trying to think what the corollaries are. I mean, when we think about conflict of interest between physicians and their patients. We have governing bodies that oversee our conflict of interest with research, for instance. What's our relationships with industry? How could that potentially be perceived when we're treating a patient if we're also decide to use something that we're a consultant for that company or something. So, I mean, the
yeah,
government has bodies that oversee
huh.
this within our own universities. We have that. Does that exist to some extent here
Yeah, it
in the
does.
sports medicine world?
It does. Yeah, the NCAA is actually pretty good, and really defines that, where they've really looked at models, basically trying to create this independent care model, in that um, the team physician is not overseen or supervised by the athletic director or the head coach. So in theory, a head coach cannot just fire a team doctor or even an athletic trainer just because he or she did not put that player back out when the coach needed him, or that physician had to fire, or that physician had to pull the starting quarterback, or the starting pitcher, because that athlete had signs of a concussion. Though those models exist, the NCAA does a very good job at protecting that. And a lot of the universities and athletic directors have really changed, I think, just in the last 10 years, to be honest with you, because that wasn't the case years ago. I mean, it still happens, and you can look at a lot of cases, and there's a lot of scrutiny of that. But when I think the question you asked is how I deal with the conflict of interest. I had good advice one time from an NFL team physician that said, Ryan, you don't want to be the nerdy guy on the sideline, but you also don't want to be their buddy that they just kind of joke around with, and maybe there could be an element of taking advantage of you. So you want to be in between there. You want them to be open with you, but you also want to um, really be able to tell them honestly in your opinion, and not get caught up into being a fan. I love when our Temple football team wins. I love, I'm sure the team doctors are so happy when the team wins championships, World Series, Super Bowls, and things like that. But I think in the back of my mind, my success isn't that based on rings or NCAA championships or Olympic gold medals, that other athletes win, because my playing days are over. Now I feel my role is to look out and be an advocate for that student athlete. So that's really how I attack, me personally, how I attack that conflict of interest. And then there's, again, with a lot of governing bodies that protect it within the NCAA, within our national societies, the American Medical Society of Sports Medicine as well as the Orthopaedics Society of Sports Medicine as well. They do a really good job representing us as team physicians in these national meetings, for coaches, athletic trainers, and for the team physicians, around there, to kind of prevent unforeseen injuries and poor outcomes for not only the athlete in the present time during the game, but also, down the road with these players, 10, 20, 30, 40 years from now. So I feel extremely protected. Even though it exists, I think recognizing it is important, and having a good team. I'm really lucky to have a really good department of physicians, and a lot of good resources of athletic trainers around me that I've been trained with and worked with, and that's the important way to not only protect ourselves, but to protect our occupation as team physicians, which I think is an important role, and to be an advocate for these athletes.
Great stuff.
Oh, man.
Very good. A lot of good tips there. And I think we're about out of time. So I've been talking with Ryan Schreiter, who is the co-head team physician at Temple Football. And our topic today has been should there be team doctors? And a lot of what we talked about revolved around conflict of interest. It was a great discussion. Ryan, I want to thank you for coming on the show. Really appreciate it.
You're absolutely welcome. It was an honor. Thanks.